I'm Dr. Subhash Gupta. We are a group of 10 liver surgeons, all from all over the country. We work together. It's a group practice, and we specialize in complicated liver surgery and liver transplantation, both cadaver liver transplantation as well as living related liver transplantation. Ours is one of the biggest liver transplant units in the world, with over 300 plus liver transplants annually. And a total of, we've done about 1500 liver transplants so far. And every day here we do a liver transplant operation, sometimes 2 or 3 in a day as well, depending on the urgency of the case. This has been a very good sort of liver center, Polo, here, where this group, which consists of 10 liver surgeons, is called the Center for Liver and Biliary Sciences. This group, which works together all the time, supports each other. Oftentimes, one of the members, Ravi Vizay, is another member of the group, and the other people who are sort of in the OT, in the ward and everything, and we work jointly towards patient care. Our motto has been to provide successful liver transplant at a cost which is a fraction of what it costs anywhere else in the world. As a result, what has happened is that there are many countries in the world which do not have liver transplant facilities, and they all come here, including countries like, of course, Pakistan, Bangladesh are very important areas from which we get our patients. But apart from this, we get patients from Middle East, Cambodia, Thailand, up north from Kazakhstan, Kyrgyzstan, Turkmenistan, to name a country, and we get it. Mainly because of the cost advantage, and mainly because of our success rate, which at the current moment is over 90% success rate at 1 year, which for a disease which is 100% fatal is very, very, very good. And main reasons for liver transplant, of course, in India is now becoming alcoholic liver disease. And we're also doing, we promote a foundation called Delhi Liver Foundation, which is working towards prevention of liver disease. Most adult liver disease is preventable, which is from, say, alcohol, or hepatitis B, which can be prevented from vaccination, hepatitis C, which can be prevented by safe blood transfusion, safe for instrumentation in medical, sort of whenever a person comes in contact with a medical doctor. Similarly, most NASH, which is a disease of the modern century, where you're obese, you're not active, and therefore you can get NASH. So all these conditions can be prevented, and Delhi Liver Foundation is working actively towards preventing liver disease. Another area which is increasingly becoming common for transplant is liver cancer. There are many liver cancers where you cannot remove the liver, part of the liver, a person will go into liver failure. So therefore we change the liver, and at least 20% of patients whom we transplant are for liver cancer. Similarly, there are conditions such as acute liver failure, where we get people who have been completely healthy, and suddenly they get jaundice and they become unconscious and they need an urgent liver transplant. And we've transported patients from all over the country, including abroad from Pakistan, where we airlift